Do you ever feel confused about what insurance words actually mean? For example, deductibles. What is a Medicare deductible and how do Medicare deductibles work? Hi there, if we haven't met yet, I'm Danielle Roberts, co-founder here at Boomer Benefits, where we help baby boomers navigate their entry into Medicare. In this video, I'll explain how Medicare deductibles work so that you will know exactly what you'll pay and when to pay it. Stay tuned to hear how you can get our Medicare cost cheat sheet, which will break down all of Medicare's deductibles, copays, and coinsurance so you can see them at a glance and better understand how and when they will affect you. And be sure to hit the subscribe button below if you haven't already done so that you'll always be notified when we drop a new video about Medicare here on our YouTube channel. A deductible is the amount of money that you pay out of pocket toward your healthcare services before your insurance begins to kick in and pay its own share. For example, if you have an auto insurance policy with a $500 deductible and you get into an accident, you'll pay the first $500 in repairs out of pocket before the insurance company starts to pay its share. It works the same way with Medicare deductibles. Both parts of original Medicare have deductibles, and Part D plans also have deductibles. Let's take them one at a time. Your Part A inpatient deductible in 2019 is $1,364. It goes up a little every year, so if you're watching this in a future year, check the Medicare cost page on the Boomer Benefits website to get the current year's deductible. This deductible is paid per benefit period, and here's how that works. When you're admitted to the hospital, a new Part A benefit period begins. Let's say you were in the hospital for 4 days. The hospital will bill Medicare for the total cost of your stay. Medicare will assign you to pay the first $1,364 in bills. This is how you meet or satisfy your deductible. Then Medicare will cover the rest of all Part A covered services for that 4-day hospital stay. Once the hospital receives payment from Medicare and sees that Medicare assigned the deductible for you to pay, it will send you a bill for the deductible amount. Now, it's important for you to also understand that since the Part A deductible is per benefit period, you could pay it more than once in a calendar year. You see, when you're discharged from the hospital, your benefit period will continue for 60 days after that. If you're not readmitted within that time frame, the benefit period closes. The next time you then go into the hospital, it will kick off a new benefit period and you owe the deductible again. So just be aware that the multiple hospital stays in 1 year could result in you paying the deductible several times. For this reason, of course, the Part A deductible amount can be a lot of money to pay even once, let alone twice in a year if you're living on a fixed income. To protect themselves, many people buy a Medigap plan to help them cover the Part A deductible. If you enroll in a Medigap plan that covers the Part A deductible, Medicare, of course, will know this. After Medicare processes the bill, it will send the remainder of that bill to your Medigap company to pay the hospital deductible instead of you paying that deductible. The Part B deductible is smaller and you only pay it once a year. In 2019, this is a deductible of $185. This one can also go up a bit each year, so again, visit our Medicare cost page for the current deductible if you're watching this video in 2020 or beyond. Here's how the Part B deductible works. Upon your first outpatient service of the year, your provider will bill Medicare. Medicare will assign the deductible for you to pay, and then it will pay 80% of the remainder of your Part B covered expenses. They leave the deductible and the other 20% for you to pay. However, most Medigap plans pay the 20% for you, so again, you have the option to purchase coverage that will take care of that expense. The billing process works much the same way as Part A. At the time of your appointment, you do not pay anything. Let Medicare process the claim first. When Medicare processes the claim, it will see that it was your first Part B healthcare service of the year and that it's subject to deductible, so it will leave the deductible amount for you to pay, and your provider will then bill you for that. Now, here's a pro tip. Be aware that sometimes your doctor's office may ask you to pay them the deductible at the time of your appointment. We strongly advise against this, and here's why. Medicare will always apply the deductible to whichever claim it processes first. So if you have lab work around the same time as your doctor appointment and Medicare processes the lab invoice first before your doctor's invoice, Medicare will apply the deductible to the lab bill. This means a lab company will then bill you for the deductible that you have already paid to your doctor. You've put yourself in a situation where you owe the deductible to the lab company And if you've already paid that to the doctor, you now have to go and chase down your doctor's office to give you back the deductible that they never should have asked you to pay at the time of the appointment in the first place. Always let Medicare process the billing first, and then your provider will bill you for the deductible, which you pay when you receive the bill. Now, at our agency, whenever this happens to one of our clients, our client service team steps in and takes over to straighten things out. We call your doctor office to explain what happened and get them to pay you back the deductible money that they owe you so that you can in turn pay that to the other provider that has billed you for that amount. This service, of course, is free to all of our policyholders. However, many of you watching this video may not have signed up for your supplemental policy through Boomer Benefits, so you may not have access to our free client service team. So I'm mentioning it here because I wanted to warn you of this to help you avoid the problem altogether. Lastly, we come to the Medicare Part D deductible. Every year, Medicare sets the limit for the next year's Part D drug deductible. In 2019, that limit is set at $415, and in 2020, it will go up to $435. But just be aware, if you're watching this in a future year, check our website for the current Part D deductible amount. Although Medicare sets the maximum deductible for Part D, each Part D company gets to decide whether it will require the full deductible from its members or whether it will only require a lesser deductible. Most plans will charge the full Part D deductible, but there's always a few out there that require a lower deductible. For example, some plans may waive the deductible altogether. Another plan may decide to make its members only pay a $200 deductible. These plans, though, may have higher premiums or drug copays to offset the fact that they are charging you a lower deductible. The way the Part D deductible works is that you pay out of pocket for your prescription meds as you receive them until you've satisfied that year's deductible. If your first prescription drug or refill of the calendar year has a retail price of $100, you will pay the full $100 and the Part D plan will apply that against the deductible total that you owe. So in this example, if your plan has a $415 deductible, that $100 is subtracted from the total deductible that you owe. Now you have only $315 left to pay out of pocket until your plan kicks in and begins to help pay for the cost of your drugs. Once the deductible is satisfied, you move into stage 2 of your drug plan, and now you'll just pay the copay or coinsurance amount for that drug based on what tier it falls to in your plan. Also, some plans only apply the deductible to certain tiers of drugs, like tiers 3, 4, and 5. This means if you have a tier 1 or 2 drug, you won't pay toward the deductible and instead you'll just have a copay. If you aren't familiar with the 4 stages of Part D, be sure to watch our video on how Medicare Part D works after you finish watching this video. One thing I've noticed over the years is that even though we explain the deductible in detail to all of our Part D clients, they sometimes forget they have a deductible. When we are going over the plan details with a new enrollee, our clients are physically looking at a plan summary of benefits, so they are both hearing it from us and seeing it on their papers that there is a deductible on their Part D plan. Even so, people sometimes forget about the deductible as time goes by, especially if they don't use a lot of medications. They might not need to fill a medication for a few months, and then by the time they go in to fill their first medication of the year, say in April or May, they may have forgotten all about the plan's deductible. So they go into the pharmacy and they get a great big sticker shock at how much a medication costs. They immediately worry that they have a plan which is no good, or they call in upset saying that their medication wasn't covered, when in fact it was. It's just that it fell into the deductible and the patient has to satisfy the deductible first. Rest assured that once you satisfy the deductible on Part D, your drug costs will go down because you will have entered the initial coverage level or stage 2 of your plan. Now when you go in to fill any covered medications, you'll only pay a copay or percentage of the cost of the medicine, and the insurance company will pay the rest. Now here's another pro tip. Before I sign off, I wanted to also point out one thing for people who age into Medicare late in the year. The Part B and D deductibles are calendar year deductibles. So if your Medicare benefits start in November this year, you're going to pay that deductible in the current year if you have any healthcare services or fill any prescriptions before December 31st. Then it resets and you'll pay it again the next year. So if your birth date is in October, November, or December, and your Medicare thus begins late in the year, you might want to consider postponing any non-urgent medical procedures or prescription refills until January. That way, you won't have any deductible spending in the current year. In other words, you won't have to meet that deductible twice within the span of just a few months. Another thing that many of our clients do is to refill their prescriptions on the employer group health plan that they're leaving just before they enter Medicare. Then they may have enough medication on hand to last them through the end of the year, and they can, of course, avoid the Part D deductible spending until the new year begins. These are just a few tips to make you aware of ways that you can control deductible spending if you're aging into Medicare late in the year. Now, I'm a little curious. What month will you be entering Medicare? Type your answer in the comments below and we'll respond to let you know when your initial enrollment period begins so that you can be sure to take the proper action at the right time to ensure a smooth transition into Medicare. All right, folks, that's it for today's video. If you'd like a takeaway that you can use to remember how each deductible works, check the description area below this video to find a link where you can download our Medicare cost cheat sheet. And again, hit the red subscribe button below before you go so that you can be notified every time we release a new video here on the Boomer Benefits YouTube channel. Thanks for watching, and we'll see you in the next video.